Global experts will gather at Parliament House in Canberra today with a message for all Australians: it's time to end loneliness. New research from Ending Loneliness Together shows the health, social and economic consequences of the pandemic will be felt for many years to come. Joining me now live is Dr Michelle Lim from Uniting Care Australia's Ending Loneliness Together. Doctor, thank you for joining us. Firstly, how would you define loneliness?
So loneliness is a subjective feeling of isolation. So you can be with other people, but still feel like you have no one to turn to or talk to, or perhaps people misunderstand you. So it's very much a subjective, feeling that isn't very obvious to anyone.
And we certainly know that the pandemic over the last few years really put a spotlight on loneliness. How big of an issue is it, even as the world goes back to some normality again?
So we do know that loneliness was an issue before the pandemic, but we do see data globally, not just within Australia, that the global rates of loneliness have increased. What we do know is that loneliness has long-term implications. We already know there's robust evidence that loneliness hurts our health, especially things like our heart health and our mental health, and also is really bad for our economy because people who are lonely are also more likely to seek services and see their GPs more often. So I think we really need to think about loneliness as an issue that's actually not going to go away, and we really need to take some actions to actually make a real difference.
There's obviously so many health problems in the world. Do you think that loneliness is often misunderstood or almost disregarded as a serious problem?
Absolutely, and we can no longer ignore loneliness as an issue. The World Health Organization is really thinking about starting a commission to address loneliness and social isolation because they recognize it's not just the devastating effects on health in well-developed countries, but all across the world. This is an issue that if we keep ignoring, it can actually become worse over time. So I think really the time is to work together and unite all sectors to think about what we can do to actually facilitate meaningful social connection.
Now, you're in Canberra taking the fight against loneliness to federal parliament. What are you calling for?
Look, we're calling for government to really consider taking forward actions that will help our workforce sector and our communities to rebuild and recover. And these 4 actions include trying to get researchers and policymakers and academics to work together to build out meaningful social frameworks in which we can rely on to empower our community, to invest in science, Australian-based science in particular, and of course to really facilitate our workforce capacity so that we can actually address loneliness within our workplaces and our schools. We know this is a problem. It's not going to go away, but without that significant government investment, we will not go very far. We all feel lonely at some point, but we stay lonely because of these systemic barriers and environments that we live in.
A really interesting topic. Dr Michelle Lim, we do have to leave it there. Thank you for joining us.
Thank you for having me.